Well, good afternoon. So we'll go ahead and begin today's press conference with an update on the numbers from last night. Today, we have 88 new positive cases for a total of 424 positive cases in 56 counties. We had 1,149 negative cases today for a total of 6,162 negative tests. We have 51 hospitalized as of last evening, and again, I'm sorry to report that we have had 2 additional deaths for a total of 6. Both were elderly adults, 81 years of age and older. One was a resident of Lynn County and one of Washington County. We have approximately 1,900 tests available through the State Hygienic Lab. The Department of Public Health has also confirmed an outbreak in a long-term care facility in Cedar Rapids. An outbreak means that 3 or more residents in the facility have tested positive. 21 of Lynn County's 71 total positive COVID-19 cases are directly related to this outbreak. State and local public health officials are working closely with the facility regarding the care of those who are sick and assisting with the monitoring of other residents and staff. Early on in our mitigation efforts, state long-term care facilities and other implemented staff screening procedures at the start of each shift to reduce the risk of exposing residents to the virus. Last week, I ordered staff screening, including a temperature check in all healthcare facilities across the state. And this is a critical step to ensure our healthcare workers are healthy and to protect the most vulnerable Iowans. Today starts the 4th week since Iowa's first coronavirus cases were confirmed, and the reality is that the end is not yet in sight. Late yesterday, President Trump announced that he is extending social distancing guidelines to April 30th to continue slowing the spread of the virus. The significant mitigation steps that we have taken in Iowa are aimed at that same goal, and we continue to assess our actions on a daily basis. For now, we must adjust to a new normal, one that's uncomfortable, it's inconvenient, and it's uncertain. And this is not an easy time. But if we know something about Iowans, it's that we are at our best when times are tough. We see it during harvest time when area farmers come together to help get the crop out of the field for a struggling farm family. We see it during times of natural disasters when people from across the state show up with donations of food, clothing, and shelter because it's the right thing to do. And now, even as our resolve is being tested in ways like never before, Iowans are more determined than ever to step up and care for their own. The number of Iowa businesses that have reached out to ask how they can help the Iowans and help Iowans in this state in this time of need has been nothing short of inspiring. As you know, one of our top challenges continues to be the national shortage of PPE, personal protective equipment. Without adequate PPE like masks, gowns, and face shields that serve as a barrier between a provider and a patient with COVID-19, our healthcare professionals are risking their own health to serve those who are sick, and we must do everything we can to protect them. As I've said almost daily on the topic of PPE, we're working closely with healthcare systems, hospitals, long-term care facilities, and others to monitor the PPE and to get the supplies where they're needed most. Healthcare providers are continuing to place orders through suppliers as they normally do, and they are ordering from the state through their county EOC. Homeland Security and Emergency Management fulfills county requests through the state and national stockpiles and also places outside orders. Currently, the state's pending orders include over 2 million surgical and procedural masks, 500,000 N95 masks, 500,000 plus face shields, and 250,000 gowns. As soon as supplies arrive, they are immediately allocated and distributed by the Iowa National Guard, the Department of Public Safety, the Department of Transportation, and others to the county and then to the facilities. As of yesterday, 153 total deliveries have been made to all 99 counties. Still, we cannot fulfill 100% of the need. Every state and healthcare facility in the nation needs the same PPE that we do, and all of them are placing orders at the same frequency that we are. And that's why, as I've said over and over, we're taking an all-hands-on approach, and it makes us work even harder to find more solutions. Here in Iowa, private sector manufacturers and other partners are stepping up with offers to produce PPE or to donate the supplies, technology, and services to do so. Increasing the number of face shields available for frontline clinicians means that they can get greater flexibility with the type of mask used. Several Iowa companies are starting production of face shields for our healthcare systems and providers. Metalcraft in Mason City and Wheaton Capital in Fairfield are developing prototypes, securing materials, and gearing up for large-scale production. John Deere is making face shields at its various plants across the state and donating them to healthcare providers in their local communities. And Iowa City Fab Lab is making face shields for the University of Iowa. Other companies are reassigning their industrial sewing operators to produce masks and gowns. Winnebago Industries in Forest City is producing masks for its local healthcare systems. And other companies that have contacted the state are preparing to transition their production so that they can begin sewing masks, gowns, and other PPE as soon as possible. And big things are happening even on a smaller scale. Eric Engelman of Nubo Co. in Cedar Rapids enlisted the help of his coworkers, his network, and an assembly line of 3D printers to create and deliver more than 3,000 face shields to healthcare providers across the state. Eric's efforts started only a week ago, but he's already inspired an army of volunteers and touched countless others, including the healthcare providers that he's helping protect. And stories of PPE donations continue to roll in. DMAC recently donated 4,000 N95 masks to Broadlawns Hospital in Des Moines, and Come and Go also donated masks for distribution to where they are needed most. The ingenuity and generosity of these partners and others will enable us to supplement our supply chain and better support the needs of Iowa's healthcare system and our healthcare providers at this critical time. So now I'm asking also for your help. If you can sew, we need your time and talent to produce fabric face masks to protect Iowa's frontline workers. The Department of Public Health has issued simple guidelines and instructions that you can find online at coronavirus.iowa.gov. These masks can be used in healthcare settings under a face shield. If properly cleaned and disinfected, they can be worn multiple times and will help preserve other medical-grade PPE. Once made, you can donate them to the healthcare facility of your choice. Just call first to find out how and where to drop them off. If you're willing and able, we need your help. So thank you for considering to be a part of the solution at hand. And with that, we will open it up to questions.
Governor, you addressed the president's new declaration announcement last night, but it doesn't sound like you've made any additional changes to any of your previous guidelines. Why not?
So I said, I kind of lost track of time, maybe it was last week, but as we extended out, I think we reviewed some of them and extended a few out, that we would take a look at the end of this week and make our recommendations going forward. Also, the president will release formal guidelines later this week, so we'll have an opportunity to look at them. We had our conference call with all governors and the vice president and the president, and actually on that talked about some of the guidelines that will be coming out, some of the surveillance, some of the metrics that we can use to make sure that we're consistent and using the right data when we're doing the modeling, and how we continue to move forward with this. So I had already indicated that we would make that decision later on in the week. We'll wait till we get formal guidance from the president, and then we'll make those decisions.
So this is a gorgeous day out today. On the drive-in, I saw a lot of folks enjoying the weather. Just under the current guidance, assuming they do maintain that 6-foot social distancing, should people still be out on the trails, riding the bikes?
Yeah, I think that's part of keeping us healthy, and just even mental health is a big component of this. We've asked everybody to shelter in and to really limit the number of trips, to limit the number of people that are going, tie them to essential needs. We've also said, we've kept our parks and our trails open. Now the playground equipment, you're to stay off of that, but get out there and get, exercise and be outdoors and continue to practice social distancing, but you can do both. And so, yeah, I would encourage that.
And also I'm getting questions about the distinctions between essential and non-essential businesses. For example, why is a Shields, for example, able to be open but not a Kohl's, or a fabric store but not a bookstore?
So a lot of times it's tied to what they're able to sell. So we're in constant consultation with the AG's office. And if you have any questions, we're also, I don't know, Sam, if we stood that up yet, we've got a group of attorneys that we're working on that can really help a lot of those business-related questions. So hopefully, by the middle of this week, or as soon as we have that information, we'll make sure that they know. But in the interim, if they want to contact us, we can get them to where they need to go to help walk them through what that looks like. But a lot of the times it will be, it's a business decision, but we can walk through the metrics that we used in deciding that.
It sounds like from today's numbers, as a state, we are testing more
Yeah.
than before, perhaps significantly more than a few weeks back here. What is the level you want of testing so that they can lower the threshold
Yeah.
that Sarah has been talking about for a couple of weeks to
Yeah.
get more people tested?
Yeah, so that's the goal, and we are all the time. We've broadened out who we're testing through the state hygienic lab. For instance, today it was 1,237, and yesterday it was 676. So as we test, you're going to see an increase in positive, but you're also going to see an increase in negative. One of the exciting things that we talked about on the call with the president and the vice president, and there was some information on this last night, but Abbott has released a new testing machine that's mobile, and it actually can get us results in 5 minutes. So you test, and within 5 minutes you know if it's positive or negative. And they are going to have the capability by this week to make 50,000 a day with the testing equipment, the machine and the testing equipment, and they're going to be doing 50,000 a day over the next 30 days. On that, of course, a lot of them are going to the kind of the epicenter of where we're seeing, but each state will be getting at least 15 of the machines, and I think this will be really helpful for us to test our healthcare providers so we can identify quickly, if they've been exposed, if they're positive or negative, and as well as maybe some of our long-term care facilities. And it is mobile, so I think, this is really good progress, and they continue to look for other opportunities for testing. So the more that becomes available, so I know we get 15, we'll hopefully get more, and I think more are coming, but they have guaranteed that at least every state will get 15. It'll go through the state hygienic lab, and then we will disperse them in a manner that, is responsible and strategic based on where the data shows that we need to be doing that additional testing. So I think that's really positive news, and we'll hopefully continue to get more information like that as we build the capacity to do some testing.
Is there an estimated date when those might be deployed?
Well, anytime. So I think, and in fact, they said when I was following up, check with some of your healthcare providers. They also potentially would get some, so we know how many are in the state and how they're being utilized. So I'll give an update as soon as those hit the state on when we get them, and maybe some of the ways that we're deploying them to really, again, be strategic in testing and getting the results that we need, and making sure, all along our healthcare, our workforce has been a consistent concern to make sure that we don't overwhelm our hospital system. We don't, we're protecting our healthcare workers, our first responders, so that they can continue to take care of Iowans, especially our vulnerable Iowans. And so we want to make sure that we're identifying, we don't see clusters of positive cases in our healthcare community.
One more question in the room before we go to the phone.
As you know, we probably get more questions about shelter in place than frankly any other topic since
Yeah.
this outbreak has begun, especially as now more than half the states have something similar, one way or the other, to that. This today was the largest amount of new positive cases. You're testing more people than
Yeah.
we have before. The president's guidelines last night, and I know you said you're waiting for more specifics from him later this week. How far from that are we, or do you feel that things that have happened so far have slowed this enough that you don't have to take that final step?
Well, I haven't had to take that final step yet, because I've told you every day, every morning and every night, we talk about where we're at and the statistics and the metrics that we've put in place, or not we, that the epidemiology team and the Department of Public Health, working with a lot of experts around the country, are deciding what they're measuring. And that was part of the call this morning, to make sure that we're getting new data. They're, at the federal level, they're requiring hospitals and states to send data there so they can have a better sampling and get some sense of what, where some of the hot spots are and how we can be prepared and ready to make decisions like that. So right now, and the way we look at this is we can look at this based on a community, a county, or a region. And so that's how we should be making those decisions, whether if we reach that certain trigger or that metric that says at this point we need to move into an order or take the next step for that area, that community, or potentially that region, and we're able to look at it from that perspective. So I think it's really important that we do it that way and continue moving forward the way that we are, because then we're managing resources, we're basing it on consistent data, we're looking at the same metrics, and I really feel strongly that that's the proper way to move forward so that we don't really impact the supply chain, we don't raise the anxiety higher than it already is, which I've had 2 hospitals in Johnson County that I checked with them again today to see if they were still aligned with what we were doing, and they are, because they know that potentially can impact, their workforce as well and their supply chain. And so, I think it's really important that we stay the course, keep making decisions based on data, and we have some that are close. So, we in a couple of different changes or variables could implement that. And so, again, we're looking at it every morning and every night. We've got a great team of experts that are helping me make that decision by giving me the information that we need to do that.
First question on the phone, so Rod at the Cedar Rapids Gazette.
Yeah, thank you, Governor. Looking at the daily numbers issued by the Health Department on positive test results, it looks like there's been an increase in the number of Iowans in the 18 to 40 age range, and the highest cohort is in the Iowans aged 41 to 60 with 150 testing positive. Does it appear that this is the spring break effect, or do you have concerns some people aren't taking this as seriously or going into self-quarantine when appropriate to slow the COVID-19 spread, thinking this is only something for Iowa's elderly to worry about?
Sarah, do you want to kind of help?
I think, Rod, what I would say in response to that particular question is that I think that what you're seeing here is evidence that we do have community spread of the virus in our state. And so I think that it just becomes all the more important for people, if you are feeling ill, even mildly ill, that you stay home until your symptoms resolve. And then if your condition does deteriorate to the point that you need to seek medical care, that you call ahead first before you visit your doctor. So, I think we're seeing cases in all age ranges. I think when you look at the deaths that we've seen and the folks that are having more advanced disease, they are kind of in our older age range, which is consistent, I think, with data that we've seen from other states and other countries as well. But the fact that we have infections among some of our younger age groups in our state does just reinforce the fact that we do have community spread in the virus, and we should all presume that it's present in our communities at this time.
Channel 5.
Hi, Governor. This actually may be a question for Sarah, but we're having people ask us why we see some counties with high numbers of positive cases and some with none at all. Is it because there's a shortage of test kits in certain areas, or is it possible that the virus just hasn't made it to those counties yet? And then we're also getting feedback from viewers saying they believe rural areas won't see the virus. If you could also share risk levels for rural versus urban areas, and if there are different mitigation strategies suggested for different areas around the state.
So I think that we know, based on our testing data, that we have had tests conducted in all 99 counties, or I don't know if the tests have been conducted there, but residents of all 99 of Iowa's counties have been tested for the coronavirus. And so I think that it's just a matter of time. We've seen this continue to spread. We have new counties added to our list of affected counties almost every day. And so I would just reiterate the point that just because a county doesn't currently have a positive case today doesn't mean that the county will not have a positive case tomorrow. And so we just really all need to understand that the virus is circulating within our communities. In some cases, we have counties that have more positive test results than others, but everybody really should heed the advice, which is stay home if you don't have to be out. If you do leave the house, make sure you're practicing good social distancing. And if you are ill, stay home and call ahead if you do need to seek medical attention. Thank you.
Because I think we had 6 new counties added today, so,
Correct.
yeah.
Caroline, go ahead.
Hi, Governor.
Hi.
I'm wondering, maybe perhaps this is a question for Sarah, but you mentioned yesterday that we're going to see the first peak within the next 2 to 3 weeks. And I'm wondering, when you say first peak, are we anticipating another peak, a subsequent peak after that? And if you could share a little bit about how you're determining that and what the amount of a peak in terms of cases might look like.
Yeah. And we've said all along, this is a marathon and not a sprint. And our goal is to do everything we can by the policies and procedures that we're putting in place to really flatten the curve and protect vulnerable Iowans and not overwhelm our healthcare system. And so each of the decisions that we've made based on the data that we've been given has really, we'll hope, accomplish what we are trying to do by really flattening the curve and spreading this out. And the good news with that is because every day we learn more and we get new ways to test. They're working on vaccines and different medicines, so the longer that we can spread this out. But we've also said that, this isn't going to be over in 2 weeks, so even if we would shelter down for 2 weeks and then open everything up, we flatten the curve, but then it could potentially spike back up again. So we have to be, thoughtful about how we approach this, and we just have to be consistent and following through with what we've asked Iowans to do. But as far as overall, Sarah, do you have anything to add to that? Oh, yeah. And so, this is Dr. Bradotti's terms, but it is so true. So that's why we've kind of dialed up some of the metrics, because we know that right now, based on the information that we have and what other states have done and the outcomes that they've seen, that if we put some of the procedures in place that we have, we will flatten the curve. The 31st, I think tomorrow was just the first 2 weeks, but as we have said, we have spring breakers that are going to factor into that, so it might be pushed out just a little bit. And then we are working with Dr. Bradotti and her team, and they are looking at really some new modeling that would give us a better idea of when we anticipate that happening, where, what that looks like, and how we can, move through that and then prepare. Some of the conversations that we've heard is that, we'll kind of peak, we're hoping to flatten it, we'll kind of come out of that again, but then we've heard, in fall, we could potentially, head back up again. So that's part of the reasons, and, not jumping right into a shelter at home order, because, this is a marathon. And so if you keep asking people to do more and more and more, and we're not basing it on data, then at some point they really are not going to take you serious. It's like, well, we've asked too much of people, and their willingness to accept and do what they need to do is really pushed to the max. And so we're trying to be mindful of that and take the right and appropriate steps, but do them, where it's needed and with the data that we've been given.
KCCI, next question. Go ahead, Chris.
Hey, Governor. So we got word today about a positive case at Wells Fargo. We've been hearing from employees concerns about how Wells Fargo, other businesses are doing with regard to working at home, or rather not doing. Is there any way you can compel any of these businesses to do more about all this, do more work from home, that kind of stuff?
Well, they have to take responsibility, but we have asked over and over that if you have the capability for your employees to work from home, you should. And, they know that. They need the workforce. They're no different than any other industry. And so in order to be able to maintain the workforce to serve their customers, those are some of the things that they can do to help ensure that they have a workforce in place to meet their needs. And so, it's not something we've ordered, but, we have encouraged, we've led by example. I'm proud to say that, I think about 70% of the state's workforce is now working remotely. And so, and when we started this, a lot of our agencies really did not even have the capacity to be able to do that. So again, I'm going to shout out to Director Annette Dunn and just at OCIO and what she's been able to do with a pretty antiquated system, to be quite honest, to stand people up with our Department of Corrections, because we have a no visitation rule. We're able to help, provide the necessary virtual visits there, which is really important too. So I'm really proud of the state team and what we've been able to do. And I think hopefully we can be an example for other businesses across the state to do what we've been able to do as well.
Clark Kaufman, Capital Dispatch.
Thank you, Governor. CMS has asked state inspection agencies to step up their oversight of nursing homes that have a history of infection control violations. Can you tell me how many Iowa nursing homes are subject to this increased level of oversight and whether or not DIA is staffed and equipped to handle that?
Well, DIA is staffed and equipped to handle that, and they have been working closely with CMS to really implement all of the guidelines. They have followed exactly what CMS and the CDC has recommended, so they have been in close consultation with them throughout the whole process to make sure that we're following the guidelines that they are implementing. So I can't give you the number, but I'm sure if you'd reach out to Director Johnson, he would be able to provide that for you. But I can tell you that, they are following the guidelines of CMS and have been in close contact with them throughout the process.
We're going to do 2 more questions. Second to last is going to Iowa Public Radio.
Hey, Governor. I wanted to ask a little bit about how your orders are being enforced. Like, how are you enforcing at bars and restaurants, and I guess things less visible, like the ban on elective surgical procedures are being enforced, and if there'll be any, kind of punishment associated with places that defy the orders?
Well, I'm counting on Iowans to do the right thing, and what I've seen for the most part that they are. And so, would start with local law enforcement, and they would be responsible. I know they have been in constant contact with Commissioner Baines, and so our office is working with him to make sure that we are consistent in what we're asking and make sure that they have the most recent up-to-date information and what that entails. So there is constant communication between our office, Commissioner Baines, and local law enforcement and communities across the state. As far as guidelines and enforcement for some of the elective surgeries and procedures, that right now is being done through the Board of Medicine. And so again, if they have questions or issues, they should start there, and they can help provide some guidance and then see where we need to go from there. But for that, it would be the Board of Medicine, and then again, we'll start with local law enforcement. But I can tell you that my faith is in Iowans, and I know that they are all doing the right thing to protect the health and safety of all Iowans. If we all step up and do what we need to do, and everybody is feeling some of the, feeling the pain from what we're doing. But if we do this, hopefully, as I've said before, we can get through this, and we'll get to the other side and hopefully open things back up again.
Last question, Beth, KCRG.
Thank you, Governor. 2 quick questions. First of all, are you considering delegating the ability of municipalities like cities or counties to do shelter in orders themselves? And secondly, do you have a number of those Iowans who have recovered from the new coronavirus?
We're still working on that. At this time, no. We're going to continue to do what I'm doing we're basing the data on the metrics, looking at communities and counties and even regions. So at this time, I think it's the best strategically for us to move forward in that manner. So we're going to continue to approach it from that perspective. And I'm going to have Sarah from the Department of Public Health talk a little bit about those that have recovered.
Yeah, thank you, Beth. The last update I had on the number of recovered patients that we had was 36 patients had recovered. Now that information I received at the end of last week, and so we're working on a variety of things as it relates to reporting information and people who are going to kind of be following up on that information and working to free up some resources for local public health agencies to be able to really focus more in on determining which Iowans have recovered. So hopefully over the course of the next week or so, we'll be able to provide more timely information related to recovery.
So I think that wraps it up. So again, thank you for being with us this afternoon. Continue to be safe, and we'll see you tomorrow. Thank you.